World pandemic disease COVID-19 has emerged as the biggest challenge to the medical world. How does the virus spread? How do we protect ourselves? What measures to be taken if symptoms arise? To answer every question and concern related to COVID-19, the Department of Health and Family Welfare Services has started a dedicated helpline. Call 104 or 080-4684-8600 or 080-666-9200 and get clarification and medical assistance. This 24/7 helpline has 210 lines and is receiving more than 40,000 calls per day. Helpline is doing every bit possible to control coronavirus from spreading at community level. How does the helpline work? An asymptomatic person recently returned from COVID-19 affected country or a person who was in touch with COVID-19 positive calls the helpline. Our helpline executive receives the call and immediately provides the details of first respondent to the hospital and suggests for the COVID-19 test. The caller receives an SMS that contains hospital details, his registration number and, if required, ambulance details. The residential detail of the suspected patient is shared to the department officials for further assistance. The helpline constantly calls the suspected patient to verify whether he is hospitalized and samples are given for testing. Parallel to this, details of the suspected patient is given to the nodal officer for community survey. But recently returned from COVID-19 affected country or a person who was in touch with positive patient has to be in home quarantine for the period of 14 days. Every day during this quarantine period, an automated IVR call goes to the suspected patient. The Department of Health and Family Welfare Services is thankful to NASSCOM, Infosys, TCS and Hinduja groups who are assisting us in carrying out this mammoth task. Post-outbreak of corona, thousands of people have migrated back to Karnataka. The department has taken self-declaration from each of them and the same is digitized. Each and every person who has returned to the state gets an IVR call every day. Calling more than 50,000 such people is the biggest challenge, and this is where the software giants are giving the support to the department. Every executive of the helpline is constantly getting technical training. There are doctors and medical students always present in the helpline centers to provide proper response to the caller. To facilitate the elderly and potential patients, the government has started 3 independent helplines. If you encounter cold, cough, throat pain, fever or respiratory problems, call our helpline and get medical assistance immediately. Help us to help you. Help us to break the chain of COVID-19.